My name is Chris Dahman, the NAC Director of Communications, and I will be your host for the event. We are recording this session, which will be available shortly on naconline.org. This webinar will be a follow-up to a session held at CinemaCon last month and is designed for those who were not able to attend the Las Vegas event. You will enter this webinar in muted mode to hold down on any background or travel noise. During the course of the presentation, you can use the chat function on your screen to ask any questions. We should have time for some questions and answers at the end of Claudine's presentation. The webinar is scheduled for an hour, and we'll try very hard to keep it to that time frame, even though I realize we're getting off to a late start. Today's webinar is brought to you by CinemaScene. CinemaScene Marketing is an industry leader in bringing promotional campaigns, packaging products, and digital media board solutions to the U.S. exhibition market. CinemaScene Media is a series of media networks which reach over 300 million cinemagoers annually. Before I introduce you to today's special guest, let me just take a few seconds to remind you that it's time to register and make your travel plans to attend the Concession and Hospitality Expo, which will take place on July 21st through the 24th, 2015 at the Hyatt Regency Cincinnati and adjacent Duke Energy Convention Center. In case you haven't heard enough about the menu labeling issue, we will be having our annual government relations panel at the Expo on Wednesday, July 22nd at 4 o'clock in the afternoon. You can find all the information you need about the Expo by visiting the Expo page on naconline.org. We will also have a few booths left for anyone who would like to exhibit at the trade show. But now it's time to get to the real reason we're here. The FDA announced on December 1st, 2014 that within 1 year, all food service operations with 20 or more outlets must list calorie counts on all menus and menu boards. These new regulations also mandate that upon request, food service operations must also provide complete nutritional analysis of all products served. We are fortunate today to have Dr. Claudine Kavanaugh of the FDA with us to discuss all aspects and compliance with these new regulations that are sure to impact us all. Dr. Kavanaugh is an interdisciplinary scientist in the Office of Foods and Veterinary Medicine at the U.S. Food and Drug Administration. She has been with the FDA for 11 years and works on nutrition policy issues. Dr. Kavanaugh's recent activities include restaurant menu and vending machine labeling, updating the nutrition facts label, and sodium reduction. Prior to joining FDA, she was a cancer prevention fellow at the National Cancer Institute. Dr. Kavanaugh received her PhD in nutrition from Purdue University and a master's in public health from Johns Hopkins University. She is also a registered dietitian. And so with that, Claudine, I turn the keyboard over to you. You can go ahead.
Okay, great. So thanks everyone for inviting me today. I've got some slides that I'll kind of go through, and then hopefully we'll have some time for questions at the end. I'm trying to go to the next slide. My keyboard doesn't seem to be working, Chris.
Okay, so why don't you just tell me when to advance the slide? I will go ahead and advance, okay?
Okay, that's fine. So next slide. So I'm talking about the Section 4205 of the Affordable Care Act, which was enacted in 2010, and that actually amended the Food and Drug and Cosmetic Act and actually covers, authorized FDA to have menu labeling on menus and also gave us vending machine labeling. So I'm going to focus mostly on menu labeling today. So we issued proposed rules in April of 2011, and we received about 900 comments. And we certainly really did, since this is a new industry to us, we didn't know as much about that, so we really did utilize a lot of the comments to inform us in making our final regulation. Next slide, please. So Section 4205 applies to restaurants and similar retail food establishments. And I want to say there are some things that were in the law that FDA kind of had to define, and there are other things that are in the statute that we don't have, we can't change or anything. So I'm going to kind of try and give you those nuances. So this part that I'm talking about on this slide is actually in the statute. So it applies to restaurants and similar retail food establishments. We defined what similar retail food establishments are, but in the law, they have to be part of a chain of 20 or more locations, doing business under the same name and offering substantially the same menu items. There's also an option if people want to voluntarily register, and that would be more if they didn't want to get covered by state or localities, and some of those cover lower amounts of restaurants, like 15 and stuff. So that's an option. Next slide, please. So the law actually requires that calorie information has to be on menus and menu boards for standard menu items. It requires all the establishments to post a succinct statement that kind of gives people the suggested daily caloric intake on menus and menu boards. They have to disclose for foods that are on display or self-service that are standard menu items. They have to disclose the calories on those, and then provide written nutrition information upon consumer request, and then they have to have a disclosure statement on their menus or menu board saying that that written nutrition information is available. Next slide, please. So the key components that I'm covering today are going to be what establishments are covered, and I'm actually going to kind of go through that pretty quickly because probably if you're on the call today, you know you're covered. What types of food are covered? Go over a little bit about alcohol and how you need to display the calories for different types of food. Some information on the succinct statement and written nutrition information, how you can determine the calories and different nutrition content of your food, and then the effective date. And the things that I have actually highlighted kind of in bold on this are things that we changed based on comments from our proposed rule to our final regulation. Next slide, please. So establishments that are covered, again, it's the three criteria that I outlined previously that are in the statute that we can't change about the 20 or more locations doing business under the same name and offering for sale substantially the same menu items. But we added a fourth option, and that's offering for sale restaurant-type food. So we really wanted to broaden the type of establishments that were covered by the proposed rule, but narrow the food to actually the foods that are similar to what's sold in restaurants. Next slide, please. So restaurant-type foods are basically foods that are usually eaten on-premise while walking away or soon arriving at another location. So obviously foods you would see at restaurants, but again, things that you would purchase at concession stands if they meet all the other requirements of the statute. Takeout, delivery foods, foods that are on a buffet, things that are on menus or menu boards, and intended for immediate consumption. And then again, the rule also covers self-service food as well. Next slide, please. Foods that aren't considered restaurant foods, things like loaves of bread, bags and boxes of rolls and cookies, whole cakes. A lot of this applies more to like things that are in grocery stores, things that are sold at weight, like at a deli counter, or they need more processing. Some of the bulk foods that you might find in like a grocery store, those types of things aren't covered. And I'm going through this part pretty fast because I think for at least this group, you probably, a lot of the things that are at the concession stands are covered since you guys aren't as much like grocery stores or that may have some things that are covered and not. Next slide, please. Okay, and we do have some foods that are exempt, and this certainly may apply to some things that you have. Anything that's like custom ordered, so if they order a sandwich but tell you to take the bacon away and it normally comes with bacon, you would not have to provide the calorie information. If you have daily specials, if you have things that are a test market and on the menu less than 90 days, seasonal items, so if you have like pumpkin coffee or something like that, as long as it's on the menu for less than 60 calendar days, you would not have to provide calorie information. General use condiments, I know for, like if you go to get hot dogs and there's a general condiment station that has like ketchup and mustard and things like that, the ketchup and mustard would not have to be disclosed. I've seen in like movie theaters, they have little packets of jalapenos if you order nachos that they just have out for people to grab. Again, those wouldn't have to be labeled. If you have popcorn and you let the people, they can put on their own butter or oil, you know, similar to what you would put on for like a hot dog. If it's just that type of facility, they would not have to label those. Next slide, please. So I kind of went over restaurant food. So any place that kind of meets the criteria and then sells restaurant food would be covered. So this would be obviously restaurants, certain parts of groceries and convenience stores if they're having food that fits kind of our definition of restaurant type food. It would include entertainment venues, so things like movie theaters, amusement parks, things like that, where you have to go through the kind of four prongs that we have. Doing business under the same name, part of a chain of 20 or more, selling substantially the same menu items, and then selling restaurant-type food. Next slide, please. Okay. One thing that we did change from the proposed rule to the final rule is actually covering alcohol. In the proposed rule, we didn't have it covered, but we got a lot of comments back really saying that it needed to be covered, and they really cited a public health rationale as well as FDA's jurisdiction to cover it. So now establishments do have to disclose calories and the nutrition information for alcoholic beverages that are on menus and menu boards. We do have exemptions, so if your establishment has like a bar and you have a lot of, different alcohol bottles kind of displayed behind the bar, those things wouldn't be covered. Drinks that aren't on menus or menu boards, like if somebody came up and just asked for a Cape Cod and it's not on a menu or menu board, the calorie information wouldn't have to be there. So it's really primarily focusing on things that are on menus and menu boards. Next slide, please. So on the menus and menu boards, first I want to kind of go over what is a menu or menu board. We looked at that really from the perspective of the consumer. It's the primary writing the restaurant or similar retail food establishment has from which a customer can make an order selection. And if you think for restaurants in different places, there can be online menus, there could be drive-thrus, there could be menu boards. You could be in a sit-down restaurant that has like tabletop kind of menus. There's lots of different varieties. So when we came up with this definition, we really did it from the point of view of the consumer because there are so many different ways and different business models to order food. And then the menu board, it includes the name and price of the item, and it's where the customer makes the order. Next slide, please.
Hey, and Claudine, I'd like to remind the listeners that they can, if they have questions along the way, they can use their chat function on this webinar. And if you have those questions, you can start asking them now, and we'll compile them and give them to Claudine to answer after her presentation. Thanks, Claudine.
Okay, great. Thanks, Chris. Then for how you actually display the calories on the menus and menu boards, the calorie for each standard menu item needs to appear adjacent to the name or price of the menu item, and it has to be in a type size no smaller than the name or the price, and it can actually be whichever is smaller. And really our rationale for doing this was, when people are going to make an order selection, they usually need to know the name of the item, and then they're usually also looking at the price. We also looked at different, they need to be in color and contrast requirements, and they have to be similar. I know I've seen at a fast food restaurant, the board was white, the name and price of the item were black, in black lettering, and then they had the calorie disclosure in yellow. I would say that probably wouldn't fit our requirements because yellow and black isn't probably quite as contrasting as black on white. So it doesn't have to be the same color, but it has to be the same color and contrast kind of requirement, so it's very visible that it's not obscured. For menus that have different flavors and varieties, so you may have something like soda on your board. For those types of things where you probably have at least 10 or more different varieties of soda, you would put a range. So it would be, in this example, it's 150 to 300 calories. If you only had something that had two options, you would have a slash. So this could be soda is a common one that we see with these. Something like ice cream would be another one where you may have many different flavors or different novelty times that you would have ranges in lieu of listing each individual one out. Next slide, please. For displaying calories for combination meals, we really look at a combination meal that consists of, it could be several food items. A lot of times it's sandwich and fries or something and a drink, and these are sometimes can be, I've seen on menu boards, they can be represented by a picture or, sometimes it's just a narrative. Those you do have to display the calories for that whole combination meal. And sometimes the combination meals may be variable menu items because you might have a choice of several different sides, having fries and a salad. Or for the drinks, you can have something that's like no calories, like water, all the way up to like full calorie soda. So a lot of times these combination meals may be disclosed as variable menu items, but it would depend specifically on how you have it on your menu. Next slide, please. So self-service foods and foods on display have to actually have their calories available. So self-service food could be things like you would have in a salad bar or a buffet line. Also self-service beverages would be considered, and it's where the customers can serving it themselves. Then the foods on display tend to be more where you might have a counter and you might have like different candies or something in, and that, the person behind the counter would have to get that for them. So it's on display and they can pick, but they can't actually serve it themselves. So all of these types of foods have to have a sign near the food that displays the number of calories per serving or per item. We do have some exemptions for this. If you have self-service food or food on display in the person, like a candy bar, I've been in some theaters where you could actually pick up the candy bar and look at the nutritious facts label. Those types of things, if people can pick it up and hold it, and the nutrition information is on there already, you would not have to have like a poster or anything with or a sign having the calorie information. Next slide, please. On all menus and menu boards, we're requiring a succinct statement, and the statement is really there to enable consumers to kind of understand in the context of their whole diet what the calorie information needs. So if they see that a combination meal is 1,000 calories and our succinct statement is telling them that on average people kind of only need 2,000 calories a day, that they can put that into the context of their diet and know, well, I'm getting 1,000 calories with this, and maybe have less hopefully later in the day. or be able to manage that. So this statement, 2,000 calories a day, is used as general nutrition advice, but calorie needs vary, is required to appear on the bottom of each page of a menu, and it must be on at the bottom of a menu board, and it will also appear next to the statement of availability that talks about the written nutrition information. So if you have a multi-panel menu board at, like, say, a theater, you wouldn't necessarily have to have the succinct statement on every panel, but I have been at theaters and different concession stands where, you know, it's almost a block long. You have to be able to see the statement when you're ordering. So it wouldn't have to be on every one, but if you have, like, a really long, 50-yard concession stand, it would probably have to be on more than once for sure, because the people would need to be able to see the statement when they're placing the order. We also have some optional statements that are available on children's menus and menu boards, since they do have slightly different calorie needs. Next slide, please. So written nutrition information is required, and I talked a little bit about the statement, which is additional nutrition information is available upon request, and that's on the menus and menu boards. For menus, it just needs to really appear on the first page of the menu. For menu boards, again, it needs to be near the succinct statement and kind of the same requirement. It doesn't have to be on every menu board, but again, if you have, like, a really 50-yard deep concession stand, you know, if you're standing on one end of it, you wouldn't probably be able to see the succinct statement. You would probably need at least a couple. And then the written nutrition information has to include basically all the nutrient information that you would see on the top of a nutrition facts panel that's on packaged foods. And again, that would just be available upon request. And you can go to the next slide, Chris. I kind of outlined, we try to be very flexible in how we allowed people to have the written nutrition information. You could have it in a kiosk, you could give out pamphlets, you could have a laminated sheet that you could just hand the person and take back, you could have it on posters. We tried to really give a lot of flexibility to the establishment, because we do know there are so many different business models in the kind of food service environment. So this slide kind of goes over determining the nutrition content of food. So how do you figure out how many calories are in your food and the different nutrients? So the law really outlined that a covered establishment has to have a reasonable basis for the nutrient declaration. Something that we used in packaged foods is called the 80-120 rule. We got a lot of feedback from our proposed rule that this was very stringent requirement, and that, you know, making like a sandwich at a restaurant isn't quite the same as like if they make a cookie at a factory. So really you can determine the nutrient value by a lot of different ways. You can use data. There's a lot of databases out there. The United States Department of Agriculture has a database you could use. You could actually send it to a lab. You could look at the nutrition facts labels for all the ingredients of your products and figure it out. You could use cookbooks and really any other means that's reasonable. We provided a lot of flexibility on how people can determine the nutrient values. Next slide, please. One thing that you do have to have with the nutrition content of the food is they have to have the information, the establishment, substantiating that they do have the nutrient values. We have to have a signed and dated statement to certify that the information is accurate and complete, and then also a statement saying that the establishment has taken reasonable steps to ensure the method of preparation kind of coincides with the nutrient analysis. So that's kind of your standard protocols for, like, if they're making a sandwich, that you have a certain amount of mayonnaise that always goes on the sandwich, and your staff is kind of trained on the amount, that you don't have somebody giving, a lot of extra mayonnaise, which could change the calorie declaration a lot. So just that there's steps for kind of more standardized procedures. And in the restaurant industry, I understand that's fairly common, that you guys normally do that. Next slide, please. We also have something called preemption. So the whole reason that menu labeling came about was because a lot of different states and localities had different requirements, and it was hard for especially the larger chains to have requirements in one place and then slightly different requirements in another place. So basically the federal requirements preempt any state or local nutrition labeling requirements. States and localities can enforce their own requirements if they're identical to the federal requirement. Establishments that, again, aren't covered, like if the chain has less than 20 locations, they can voluntarily register with the FDA to be covered. They would normally do that if they kind of probably wanted to get out of their local requirements. And then states and localities do have the option of petitioning the agency to be exempt from these requirements, and we've actually already received a petition from the city of Philadelphia to be exempt. We haven't ruled on that yet, but we're still reviewing that. Next slide, please. The effective date is December 1st, 2015. In our proposed rule, we had 6 months. So we did extend it out to 1 year. I will say that we've received several requests to extend the compliance date past December 1st, 2015. One was actually from the National Association of Theater Owners. We have not made a ruling on those extension requests yet. We usually would be on our website and probably in the media if we do end up giving some kind of extension request, and it would probably be on if we didn't end up doing that too. But we have not decided. The agency is still considering those requests. Next slide, please. So the next steps, we're developing a guidance for the industry. We've gotten a lot of questions from different industry members. And we've actually had some of that in our utilizing those for our guidance documents. We did have a guidance document come out in March, the beginning of March, and that really kind of outlines, and it's available on our website, it outlines the kind of the rule in more plain language and a question and answer format. So it's a little bit easier to read if you're not a lawyer, because I know sometimes with our regulations, they can get very legalese. So this is in more of a plain language format. But we are planning to have another guidance document come out soon, which will hopefully help the industry implement the regulations. We're working on our enforcement strategy, but one thing we are planning to do is really do more of an education-focused enforcement plan for the first year. So if establishments are really making a good-hearted effort to post the calories and everything, and, maybe they just made one little mistake, we're really more about educating how to correct that versus sending warning letters and getting into some of our other enforcement options. And then we've tried to do a lot of stakeholder outreach. A lot of our staff have had webinars like I'm having today, or have gone to different meetings to speak. I know other groups have come in and talked to us, so and we have been giving questions in and trying to answer those. So we really have been trying to work with the industry to help everyone implement the regulations. Next slide, please. And this is actually the last slide. So I have my email address, but I also have, if you have specific questions about the coverage, if you can send it to the second email address, calorie-labeling@fda.hhs.gov. We've gotten a lot of questions in. Some of these are more overarching questions that we've put into our guidance documents that we're hoping to have out soon. But a lot of the guidance, a lot of the questions have been very fact-based or specific to like a specific location, and we have been giving responses back to people on that. I will say we've gotten a lot in, and we've been, doing it in queue. So when they come in, we get the first ones in and have been responding. So we might not have responded to everybody yet because we have gotten hundreds and hundreds of questions, but we definitely have started to respond to different groups. So if you do have a question, that is especially after this call, that's a good time to put that into that email address. And I think that was my last one, so I'm happy to answer any questions.
Okay, thank you. And I will let you know that those email addresses are listed on the government relations page on naconline.org. Claudine, we do have a number of questions that have come in, and I will tell you that we had over 40 folks on the webinar today, 40 industry professionals. We got some really good questions, so hope you're ready for it. Okay, first question. Please provide examples of how nutritional analysis of products should be disclosed.
So the nutritional analysis would be, that would be more for the reasonable basis. If FDA came in and you had your popcorn saying it was, 400 calories, we would ask you to provide information on how you figured that out. So if you gave it to a lab, we would just need the lab analysis kind of report. If you calculated it from a database, you would probably have a printed out thing from the database saying that this much popcorn is this many calories. You could give us copies of the nutrition facts labels for like the popcorn and the butter. So there are several different ways that you could do it. Those were just some examples. You could use a cookbook. There's a lot of private groups too that would probably figure it out for you. So there's lots of different ways, but we would kind of need to see, and this would be upon request, how you guys figured it out.
Okay, thank you. Here's the next question. We are in an arena as a self-operating concessionaire. Are we exempt from needing to label our menus digital menu boards?
I was going to say that one I would probably need a little bit more information. You would probably have to give us some more specifics to our thing. But if you have kind of a general concession stand and it has 20 or more locations and it doesn't really have kind of a name, you may be included, but we would really need more specifics. So I would encourage that person to use the calorie labeling address and give some more specifics on that.
So some of these things may be decided on a case-by-case basis, is what you're saying.
Yeah, because with that one, I don't really have enough information to be able to answer that. The other thing I would do is just go through, if you meet the kind of 4 prongs, you have 20 or more locations, doing business under the same name, and that kind of gets into the concession stands if there's a name or not. So I would have the group really focus in on that part of the regulations, really look at that. If it's a concession stand, it's probably selling restaurant-type food. And then are they substantially the same menu items as well is something else that we would look at. So you really need to look at those kind of 4 prongs to see if you would be included. Because there are scenarios where sometimes they may not be included and scenarios where they could be included.
All right, thank you. Here's the next question. How do you display calories on combos where the items are variable? Is it a range?
I didn't hear. How do you display calories on what?
On combos, combinations where the items, yeah.
Yeah, a lot of those would be ranges because there would be variability in like the types of drinks that you could have, and even potentially the sides. You could have a salad or fries. So for those things, a lot of times combination meals would be variable menu items, and it would be a range.
Okay, thank you. Here's the next question. I represent a theater circuit in Canada. We currently do not have these labeling rules. Is there any work being done between the U.S. FDA and the Canadian FDA?
I was going to say, I mean, we do have, I I don't know if we've worked together, but I mean, they're aware, Health Canada is aware of what we've done, but that would be, if they wanted to do something, that would be their decision. But I do know they are aware that the United States has that.
As a follow-up to that, do you feel like they're likely to follow suit?
I have no idea.
Okay. I do have a question here. Where can I find a copy of this PowerPoint presentation? I would direct you to the government relations page on naconline.org, and then also we are recording this session, and we will be posting that as well. Here is the next question. Does each location need the backup substantiating the calories, or can corporate hold the master and provide upon request?
We have gotten this question before, so we would have to get it in a reasonable amount of time, and I think in our rule we do talk about this, but I think corporate could hold on to it, and, if we got it in a day or so, but I think that would be fine. So corporate could have the information versus each individual establishment.
Okay, next question. And I will just read this. Will hawkers selling items in the seating area need to have the statements on their buttons along with calorie and price info?
That is one that I think would probably be a good one to send into our mailbox.
Okay.
I think that one would be good. And again, give some specifics, like how many do they have? Because at least when I've gone to stadiums and stuff, sometimes they have, you may not have 20 or more of those and things like that. So I think we would need some more specifics and to address that.
Okay, next question, and it's a follow-up. If we have certain mom-and-pop subcontractors, will we have to ensure they are following the rules, even though they do not have 20 locations?
Okay. If they do, if it's kind of a self-branded thing, so I'll give this example. This isn't quite the same, but if you have a stadium or something and have a Starbucks in there, it would be Starbucks' responsibility to have the calories and calorie information. So if you had a kind of branded establishment that was more mom and pop that didn't have 20 or more, they probably would not have to display the calorie information. But I would, the person who asked that question, I would refer them to the part of the rule that talks about doing business under the same name and some of those requirements. Because a lot of that is case by case. But again, if it's a facility, if it's like a Starbucks, there's more than 20 Starbucks, and it's in like an independent bookstore, the Starbucks would have to disclose the calories. And kind of the inverse is true. Is if you had a stadium and you had a mom and pop place that is definitely branded, it's its own thing, and they didn't have 20 or more, they would likely not have to have the calorie information. But go to the section in the rule that does doing business under the same name.
Okay, and I think this might be a little bit of a question on the same mode. Can you talk a little bit about eateries within a theater?
So the eateries of the theater, if it's kind of a concession stand, and they have, again, meet all the prongs of doing business under the same name, and sometimes those concession stands don't have a name, so it would be kind of the name of the theater. But if they have, I know we have gotten questions about that there's some branded groups that maybe didn't have 20, that maybe the theater or theater leases to another restaurant that doesn't have, 20 or more locations, they would likely not have to post calorie information. But again, I would direct the people asking those questions to the part of the law that goes under doing business under the same name, because there's definitely some variability. And I think this just gets to the complexity of there are so many different ways that the industry does business.
Okay, we have another question. Many arenas turn over a concession stand to a not-for-profit group for the day. Are they covered?
I would put that one in, and I would probably ask for more information on that. if it's you turn the concession stand over and they're just working it, but they're serving like the same food as all the other concession stands and they're just making the money. I think I haven't heard that question before, so that's one I think we would have to think a little bit more about, and I would encourage the person to put that to our email address.
Okay, thank you. We have one more question, and it is, what is the likelihood that there will be a deadline extension?
As I said, we've gotten about 4 requests for that already. We're certainly considering those, but at this time the agency hasn't made a decision, so I really can't comment any further on that.
Okay, thank you so much. That's the end of our questions. Would like to say thank you for attending today's NAC event. We'll take one more opportunity to thank Dr. Claudine Kavanaugh of the FDA, so thanks again, Claudine. For helping us understand and navigate this important issue. And a special thank you to CinemaCon for participating as our presenting sponsor for today's event.
All right, thank you all.
Thank you. Also, one more reminder to make your plans to attend the Concession and Hospitality Expo in Cincinnati on July 21st through 24th. For all of us here at NAC, thanks again and have a great afternoon.